Welcome to The Explainer. Today, we're diving into a really tough one of the most persistent challenges in orthopedics. We're talking about a type of hip fracture in young adults that, for decades, has been just notoriously difficult to fix.
This quote really just nails it. For surgeons, the femoral neck fracture isn't just a simple break. It's a puzzle, a biomechanical enigma that has really resisted easy solutions, especially when a patient doesn't get to the hospital right away.
And this is the specific puzzle we're tackling today, the neglected femoral neck fracture. Now, this isn't your typical slip and fall kind of break. In young adults, this usually happens from some kind of high-energy trauma, like a major car accident. And that word neglected is key. It means at least 3 weeks have passed without treatment, which is plenty of time for the body to try and fail to heal it on its own. And this right here, this is what that failure looks like on an X-ray. The head of the femur, that's the ball in the hip's ball and socket joint, is completely separated. You can see how the bone edges are starting to resorb and shift. For a young person, their mobility, their job, their whole future is literally hanging in the balance. The stakes here are just incredibly high. I mean, if this fracture doesn't unite, two catastrophic things can happen. First, you get what's called a non-union, where the bone just gives up on mending itself. And second, something even worse, avascular necrosis, or AVN. That's where the blood supply to the femoral head gets cut off and the bone literally dies. Either one of those can mean a lifetime of pain and disability, forcing a young person to think about a total hip replacement way too early. So what makes this one fracture so incredibly difficult? Why is it an unsolved problem? Well, the answer isn't just about biology. It's about physics. It's a battle against the fundamental forces that are acting on our hip joint every single day. Okay, so on the left, you see the big problem, shear force. When that fracture line is really steep, almost vertical, your body weight creates this downward slicing pressure. It's constantly trying to pull the bone fragments apart, which makes it pretty much impossible for them to knit back together. But on the right, you see the solution, compressive force. See, if the fracture line is horizontal, that same body weight actually pushes the fragments together, creating the perfect, stable environment for bone to heal. And this brings us to a huge realization in orthopedics. Surgeons figured out that you can't fight the physics, but what if you could change the physics? If you can't change the force, well, then you have to change the angle of the fracture itself. All right, so let's check out the first really ingenious solution. It's basically a biomechanical hack that's designed to completely outsmart those destructive forces we were just talking about. It's called a valgus intertrochanteric osteotomy, or VITO. Yeah, it's a bit of a mouthful, but the concept is just brilliant. An osteotomy is really just a surgical cut in a bone. And in this procedure, surgeons make a very precise cut lower down on the femur to fundamentally change the entire geometry of the hip, and by doing that, they change the forces acting on the fracture. This diagram shows you exactly how they do it. Surgeons remove a very carefully calculated wedge of bone from the femur. Then, when they close that gap, it tilts the entire upper part of the bone. And just like that, it dramatically changes the angle of that original fracture line. And this is the beautiful result. Just look at the fracture line now. It's almost perfectly horizontal. Those destructive shear forces have been magically converted into helpful, constructive, compressive forces. So now, every single step the patient takes actually helps push those bone ends together, encouraging them to heal. It's such an elegant mechanical solution to a really complex problem. Okay, so let's move on to another strategy. This one tackles the problem not just from a mechanical angle, but from a biological one too. Because, sometimes changing the physics isn't quite enough. You also need to give the healing process a serious jumpstart. And one way to do that is by using a piece of the patient's own fibula. That's the smaller bone in your lower leg. This little piece of bone, this graft, does two critical jobs. First, it acts like a strong internal support strut, giving it mechanical stability. And second, it's a living biological scaffold, a framework that basically tells new bone where to grow across that fracture gap. The procedure itself is a pretty amazing feat of biological engineering. So first, they harvest that piece of fibula, then the surgeons will drill a precise channel right across the fracture. They carefully slide that fibular strut into the channel, creating an internal support beam, and then they'll lock everything down with screws for extra stability. And here is the proof, right here in the pudding. On the left, there's that same neglected fracture we saw at the beginning. But on the right, that's the result after the fibular graft. You can see the graft and the screws holding everything steady, But the most important part, you see solid bone union. It's an absolutely remarkable transformation, turning what looked like a hopeless situation into a healed hip. So you might be thinking, why go to all this trouble? Why perform these really complex surgeries instead of just, putting in a total hip replacement? Well, for a young adult, the answer is everything. Saving their own natural femoral head means preserving their quality of life. It avoids, or at least pushes off for decades, a hip replacement, which we know has a limited lifespan. It lets them get back to work, to sports, to all the activities that make them who they are. This quote really drives the point home. This isn't just about being able to walk without pain. For so many people around the world, it's about being able to do basic, culturally vital things, like squatting or sitting on the floor cross-legged, things that a hip replacement can make really difficult, if not impossible. Preserving the natural joint preserves a whole way of life. So in the end, by really digging in and understanding the underlying physics and biology, surgeons came up with these incredible ways to solve what was once called an unsolved fracture. And it's just a powerful reminder that with enough creativity, the limits of what's possible in medicine, well, they're constantly being redrawn.